takes like 45 minutes to download an hour, so because it's 4K.
Whenever you're ready.
All right, we're recording.
Yep.
Oh, gotcha. Okay. Hello, welcome to another installment of Fireside Chat at Keil Lasik Vision Center. We're here with our founder and our
Hello.
surgeon, Dr. Keil. So we want to kind of introduce everybody to Dr. Keil a little bit, get some history, and share with you how he came about this career. And so, Dr. Keil, just want to thank you for joining us. And
Thank you for having me.
Thank you. And I want to ask you a little bit, how did you get into this career? Where did you get your education? And
Well, full disclosure, my dad is an optometrist, and so I was exposed to healthcare, eye healthcare, from when I was a child. And optometry. A lot of people don't know the difference between optometry and ophthalmology. Optometry, they primarily do glasses and contacts to fix refractive error. In other words, if you can't see that well, usually they can give you a pair of glasses or contacts.
Yeah.
If it's a deeper disease, like you have cataracts or you have glaucoma, or it's a surgical requirement, then optometrists typically refer to an ophthalmologist for surgical care. And so, I was interested in optometry. I was interested in a few different things, didn't really know what I wanted to do exactly. And so I decided that medical school was a better option for me because that gave me additional options. I was able to keep my options open, so to speak. And so I could still do eye healthcare if I wanted to, or I could do OB-GYN or emergency medicine or whatever, And so I went to medical school, and I delivered babies and sewed up people in the operating room, and did orthopedic surgery and all that stuff as part of my rotations. And then I finally rotated in ophthalmology, and I just fell in love with it. It just really sort of fit my perception of what surgery should be. It's elegant and refined and precise, and it suited my perfectionistic nature.
Yeah.
And and you can make a really profound impact on somebody's life with refractive surgery, with doing eye surgery.
Nice. So what school did you go to?
So I started out in, I grew up in Manistee, Michigan. So I went to West Shore Community College in Scottville, Michigan. They're most famous for the Scottville Clown Band, which tours all around the country, actually.
Oh, I didn't
They
know
do
that.
parades through the summer and all that stuff. There's also a famous singer, Maynard Keenan. He's from Scottville, Michigan.
Okay.
Maybe he's from Ludington, but either way, it's still the same thing. But his joke is he's a member of a band called Tool. Yeah. And so he has other bands out there, but that was the most famous one. And his joke was, when he came to a concert here in Grand Rapids, he said, "We are the Scottville Clown Band." And so that's where I got my start. And then after a couple of years there, I was getting a little bit tired of the whole small town thing, small college. So I decided to go to the biggest college in the state, and that's Michigan State University. And so I got my undergraduate degree in Bachelor of Science at Michigan State. And then I actually worked at the University of Michigan for several years because I wasn't quite sure if I wanted to go to med school or grad school at the time. And so I had the opportunity to work with grad students and med students, and spend time at the hospital and kind of get an idea of what I really wanted to do, Yeah. And so I just found that I was definitely more interested and suited for medical school. And so, like I said before, I went to medical school at Michigan State University again, actually. So I went from Michigan State to Ann Arbor to Michigan State. And I did take one class at the University of Michigan, so I guess I can kind of claim that one a little bit too. But and my wife is a graduate from the University of Michigan. And so, yeah, I went to medical school at Michigan State. I joke around because I had so much fun as an undergrad, I had to go back for medical school. But no, medical school was great. And I still really wasn't sure what I wanted to do at the time, but I found that I had an aptitude and an interest in surgery. I always liked working with my hands. I was always good with, doing small detail work with my hands, And then, again, I rotated in ophthalmology, and it just really fit what I was looking for. So
nice. Mm-hmm. And then how long have you been the owner and of Keil Lasik Vision Center?
So just to back up a tiny little bit, so in ophthalmology education, you get an undergraduate degree, and then you go to medical school and get a degree, and then you do a residency. And so residency is another 4 years. So the whole training process is 4 + 4 + 4. So it's kind of a long process. Beats working. So I did my residency here in Grand Rapids in affiliation with Michigan State at what was called Metro Hospital at the time, but is now the University of Michigan Medical Center. So then after I graduated from there, I continued teaching for the residency program. And then I started my own practice, renting space from another doctor in just general comprehensive ophthalmology, doing cataract surgery, doing glaucoma procedures, doing lid procedures, all that stuff. And then a company called Lasik Plus came to town, and that's where our current location is. And they, they hired me, and I was their LASIK surgeon for a couple of years. And then we had the Great Recession, and so that was in 2000. So I graduated from residency in 2005, started my practice that year, and then I was doing that, and then I was also teaching at Metro, and then I was working for LASIK Plus. So I had 3 jobs basically at the time, and it was a lot of fun. It was exciting times, and I kept learning a ton, and then like I said, we had the Great Recession in 2008,
Mm-hmm.
and so LASIK Plus, the not LASIK numbers went down because of the economy, and then it just turned out to be the best opportunity for me,
Yeah.
because LASIK Plus decided to close the center down, and so in 2009 we closed as LASIK Plus, and then really that December of 2009, I started Keil LASIK Vision Center, and we opened officially in January of 2010, and so I've been at it in this location since '06, actually.
Yeah.
So I've been here doing LASIK since '06, but it's formally was Keil LASIK Vision Center at the end of 2009.
Nice. Exciting. And how many eyes do you think you've done to date?
Well, I know I've done at least 16,000 now.
Yeah.
The numbers. It's hard to imagine that many numbers.
Yeah.
And
Yeah.
I calculated how many eye exams I've done, and it's approaching 100,000 eye
Yeah.
exams
Yeah.
now.
Yeah.
And so you think it might get old, but it's just there's always something new. There's always something interesting. I just a couple of years ago I went around the world training and enhancing my skills
Yeah.
in surgery, because there's always something to learn somewhere in the world. And so we've been able to add new services and take care of more patients.
Awesome. The last couple questions is, what do you think is the biggest unknown for about LASIK, and then 2, where do you see the future of refractive surgery?
The biggest unknown, I think the biggest unknown is, people don't really realize uh, that it's really safer than the alternatives.
Yeah.
People think that glasses are safe or contact lenses are safe, and it just really isn't true. I mean, I've told the story before where I had a patient who was driving his motorcycle on the freeway without a helmet, wearing glasses, and he looked to the side and his glasses went flying, and then he couldn't see.
Yeah.
Here he is on a motorcycle, no helmet, on the freeway at 70 miles an hour, and
Yeah.
all of a sudden he can't see. That's not safe.
Yeah.
And that's why we have military, firefighters, police in here all the time getting this done, because if you're in an emergency situation and you can't see all of a sudden, that's not safe. So, people think that LASIK isn't safe, but it is. It just is. And so for that reason, I had it done on myself. I did my wife's, I did my brother's, I did my sister-in-law, I did my oldest son and my second oldest son, and my third oldest son thankfully doesn't need glasses yet, because I'm in it. I know it. I know I can do it. I can do it safely. I can do it effectively.
And plenty of
And
Keil
so,
LASIK staff members and family
yes,
members. So it's,
absolutely. I mean, pretty much everyone who qualifies
yeah.
has gotten it done.
Yeah.
And I just, I had it done on myself, and I just love to be able to share the experience. I mean, I had it done in 2007,
Yeah.
and I've been glasses free ever since 2007, and now I'm just turned 56, and so I'm still not wearing glasses. I'm still better than 20/20 vision, and it's just remarkable. I mean, my eyes are so much more comfortable. I used to wear contacts all the time.
Yeah.
And in my 20s, I was constantly putting drops in my eyes. Now I'm in my 50s, and my eyes are more comfortable than they were than in my 20s, because I'm not sticking a foreign body in my eye all the time.
Yeah. Yeah.
And glasses, were irritating. They hurt my nose and they hurt my ears and they gave me headaches and all that. And it's just been very nice not to have to deal with that. And so I really enjoy being able to share that with other people.
Great. Well, thank you. And
So
then
where
the
do you ask where
future.
do you think the future is?
Yeah. Yeah.
Now we have something. I mean, we can do something for most prescriptions. If you have astigmatism, if you have nearsightedness, we can take care of that. Certain degrees of farsightedness, we can take care of. When people get into their 50s and 60s, we can get rid of their dysfunctional lenses, so we can make it so they can never get cataracts when they're older. We can get rid of bifocal lenses. But there's a few areas, like for people who just need reading glasses. I was just listening to a podcast on it today, actually. There's something that's probably going to be coming out in the next couple of years where it kind of turns the clock back on needing reading glasses. So, people who their distance vision is great, they've had great vision their whole life, get into their 40s, and all of a sudden the near vision starts to go. Right now we have eye drops that help with that, but they only last for 5 or 6 hours, and you got to do it every day. And there are some other, minor side effects with that, but it does work. But really, the next big thing I think is solving this problem that we call presbyopia, and that's just the need for reading glasses. And that's not too far off. I mean, there's some options in the not too distant future where we have a surgical procedure that we can do that's very similar to LASIK, but even faster recovery, and even more gentle on the eye, actually.
Nice.
And so I think that'll be a real breakthrough.
Yeah.
I mean, there's always interesting new things coming along, and we've been lucky enough and fortunate enough to be able to offer the best of all the new technology that we have available, along with all the great old technology that we've had available for a long time. I mean, LASIK is old now.
Yeah.
I mean, it's 30 years old now. And so we've got so much great old stuff we've been perfecting, and a lot of cool new stuff.
Nice.
Yeah.
Well, thank you, Dr. Keil. And
My pleasure.